What is your first name and who are you to me?
My name is Johnny Gerald, and I'm Brandy's grandmother.
And I'm Roy Gerald, and I'm Brandy's grandfather.
I thought you were going to say grandmother. Ooh, we're going to have all kinds of bloopers already.
I'm her grandmother.
Lisa and your mother. I am Casey, otherwise known as Nova Case.
And otherwise known as
Kitty. And I am Brandy's sister.
I love you.
I love you too. My first reaction was just like, honestly just shocked, because I don't think any of us expected anything like that. Especially because, I mean, I knew that you were always feeling sick, but I never really expected something like that. Like thyroid disease or Graves or anything like that.
Nothing serious.
Yeah, exactly. I thought maybe there was just something small that was wrong with you that could get fixed, but of course, anytime we ever get sick, it can't ever be something little. It's got to be something huge.
Yeah, I mentioned the fact that you also have an autoimmune disease in my intro video, and if you would not mind saying what it is called.
Okay, I had never heard of this till the doctor told me, and my first reaction was, I've got a what in my what? Mine is Henoch-Schönlein purpura, and it tends to manifest, it looked like chickenpox when I first had it, but only from like the knee down, concentrated around my ankle area. There weren't any bumps, but it was just little teeny red dots. And then it escalated, and it got worse, and it started out slowly escalating, then it exploded, and suddenly I had lesions all over my legs and ankles, and now I've got scars.
That such a young person would have something such as that, because normally you don't hear that much of it.
Holy crap. Not happy at all. It meant everything. I had to be there for you regardless of, no matter what. Josie did too.
Yeah, yeah. And you went with me to a lot of my initial appointments and stuff too.
Yeah.
Had a lot of fun in the doctor's office talking about how bad we had to potty.
Mm-hmm.
That's gonna have to...
And the doctor's PA messed up and thought you needed a colonoscopy.
A colonoscopy. That's gonna be a whole nother story, guys.
Honestly, I was freaked out. I was freaked out because my little sister, and she's sick with something serious. And then I found out you had to have your thyroid out, and that freaked me out, the thought of you going through surgery or anything like that. Of course, I flipped out over that because, you know, you're my baby sister.
Well, it was sort of stressful at first because it was something new we never had anything to do with before. We hadn't had to deal with anyone that had this illness. And it took a lot of trying to figure out just exactly what was going on and what we could do to help, and basically just that.
Yeah.
Very worrisome, because not having been around it before, you have no idea as to how serious it is and what medications she's going to need and what the total outlook is. That all just by virtue of not having any knowledge of it.
Watching my child, who is always active, always wanting to go everywhere, be taken everywhere, do everything, all of a sudden go to bed and not be able to function as a normal young adult. Honestly, just worrying about you because I know you haven't been yourself for a long while. It took a long while where you weren't yourself at all, and now you're getting to be more yourself again. But there was so long where you couldn't do anything, you couldn't hardly move without getting sick again. And it was hard just to watch you go through that, just because I hated that I couldn't do anything about it. Because, you know, we've always been really active and done a bunch of stuff, whether it was just hanging out and laughing or
being dorky daredevils with I bet you can't do this and I bet I can. And God, how many injuries did that result in when we were little?
Yeah.
We did stuff like that all the time.
Yeah.
And then suddenly you weren't even able to just hang out and goof and laugh
No.
without feeling horrible afterwards or without draining yourself like that. And
Yeah.
that was scary, and I hated watching it just because I couldn't do anything to help it.
Yeah, it was very tough. Very tough.
It was scary.
And all I did was pretty much lay there, feel sick, and cry.
Yeah.
That was all I did.
Yeah. And it's just as scary.
I'd say the most difficult part is being able to finally get stabilized on the medication, because it's been, and especially because it takes 6 weeks to find out if the medication's doing any good. And then we'd have to go to another round of medication, and this continued for several weeks. And it's really been good to finally get it. Looks like it's on track now.
It was just frustrating to go from doctor to doctor, and them jockeying the not the diagnosis but the prescriptions around. First very high and then very low, but thankfully now they've got it pretty well regulated.
Thank goodness. I think we can all say thank goodness on that one.
Okay. I think that you're making great progress, and I think that it's been a while coming, but it looks like things have finally hit an even keel right now, and it seems to be moving on very well. And I feel very hopeful that before long you'll be able to be back to the person you were before you ever found out that you had this problem.
And I agree.
Well, it's definitely not going to get worse. That's the big problem that we were scared of is it going to be able to get better, or will it progressively get worse? At least where we are now, we're more stable, and while it can get better, at least it can't get worse anymore.
Well, I think what the most positive thing is that you're getting to be more of yourself again. And there's also the fact of, because of this, you've been inspired to raise awareness about it.
Mm-hmm.
And because I didn't know much about it, I didn't ever think about thyroid disease or anything like that whenever, before.
Yeah.
Or even, I didn't even think much about autoimmune diseases, because it's one of those things that you don't think a lot about until it directly affects someone you know.
Mm-hmm.
Because unless you know for a fact already, because someone you know has one, that you're genetically predisposed to it or anything like that, you don't think about these things. You go through life thinking, oh, I bet that'll never happen to me.
Mm-hmm.
And so you push it to the back of your mind because you don't know of any people with it, so you assume that it's not very common. But it turns out a lot of times to be more common than people realize.
Mm-hmm.
And it's good to see that you've turned this into a positive thing by deciding to raise awareness about it and bring it to people's attention. And for one thing, letting people know that if there's something wrong with them, to get checked.
Yeah, don't let people tell you that you're crazy if you know something is wrong. If you honest to God know something is wrong in your body, do not sit there. You have to get attention for it.
Yeah.
My mom thought that I just had a stomach virus, but it was going on for almost 2 months before I even went to the ER. And the only reason I went to the ER was because I was helping my roommate at the time cook, and I almost passed out right in the middle of the kitchen.
Yeah.
Because I was feeling so sick and lightheaded. So you really have to listen to your body on that. Do not just let people tell you what you feel.
Yep. Yeah, because it's good to just see you back to yourself again.
I'm back to being hyper and active and silly.
Which is good to see.
Yeah.
Because I missed that. I missed my best buddy Deedle.
Out of the 3 of us kids, I was always the big goofball, the hyper one who always did anything they could for a laugh.
Yep.
Absolutely.
Oh, yeah. Yeah, she was the goofball. I was the bookworm.
Including getting myself in trouble.
Damien was just trouble.
Oh God, ain't that the truth.
Knowing that it wasn't cancer, that was a big high point. because that was scary. That was a thought that ran through my mind.
That's what they told me it might have been at first.
When they wanted the biopsy and we didn't have to do that, I didn't have to watch you go through that. That was a scary thought.
Yeah.
Probably all of this, honestly, because it's nice to see. I like seeing whenever people start raising awareness for things, whether it's directly affected them or they just see it and they find it an interesting issue and decide they want to really get active about it. But yeah, though, probably all this, because like I said, I didn't know much about it. I never thought that it could directly impact somebody in my family, just because I didn't hear about it much.
Me either. I never thought it would even happen to me.
And I had only really heard of hypothyroidism before.
Because that's the most common.
Yeah, we keep getting distracted.
Yeah.
This is what happens when you get the two of us filming a video together.
We always get distracted.
Yes.
I love you.
You're a big goober.
I'd say really just here lately, being able to know that your medication is effective and it's not one day up and another day down and another problem with one thing and then another, and it seems everything seems to have leveled off, and that is very great, and we're very optimistic about it now.
Yeah, we can be optimistic about it because you do seem to have leveled off insofar as having the right amount of medication and the way it affects you daily. You still have some episodes, but they aren't nearly what they were once upon a time, so that's a very good outlook, really.
I can actually go out with you guys now and run errands and not have to worry about feeling sick every 2 seconds.
Right.
So actually being able to be out of my room and spending time with you guys has been a high point for myself personally.
Yes, that's been a good one for us too.
I think, for one thing, if you do have it, it's nothing to be ashamed of, obviously. I mean, medical problems arise, and when they do, you need to for one thing, make other people aware of it, so that if maybe you're really excited and involved in something and you're starting to show signs of it, but you're too concentrated on things that you don't really pick up on it as much, other people can be alerted to it, because while you do know your body, other people can pick up on little cues a lot quicker than you think they can.
Yeah.
And if you're focusing on something else at the time, like you've got an event going on that you're having fun in, sometimes it can take a little bit to realize you're feeling sick. And another thing is that if you do have something like this, definitely make your loved ones aware, especially if they're like siblings to you or direct blood family, because if something starts going wrong with their bodies, they do need to get checked for it. It's like where you have thyroid disease, every single time I get sick with anything, they immediately do a panel to check my thyroid. But another thing is, especially also with that, is the Graves' disease, especially if you've got it, not just the thyroid disease, if you've got, honestly, really any autoimmune condition.
Yeah.
Your best bet is to, definitely let your loved ones know, because a good example is, Brandy got one, and then almost a year later, almost exactly a year later, I developed one. And if one sibling develops one, it is possible for the other to develop one. It's good to give your loved ones a heads up with the fact that they might as well. Plus, you need that support system of your family and your friends, or it doesn't have to be blood family, obviously, because family's not just blood. Just the people that you care about and that care about you need to be aware of it so that they can be your support system.
And 9 times out of 10, they will do their best to support you in any possible way that they can.
If you have anything like that, you don't want to wear yourself out. If you feel like you need a break, you need to take a break. Because if you feel like you need to take a break, your body's telling you that you need to take a break for a reason.
And you can cause yourself to have a flare-up.
Yeah, that too. That too.
I'm not exactly sure, other than just try and be patient, because it does take a while to get these levels just right in a person's body, while you normally never think about anything like that until you're presented with this problem, and then once you see it's not just as easy as you think it's going to be. It takes a while to get the medication right. It takes a while to get to where you're feeling normal again.
Very true.
Be patient and be hopeful.
All right.
I would agree with that, and I think that the thing a person has to try and avoid is seeing other people on the Facebooks, etc., where they've had the same problem and they have almost an immediate recovery with no side effects.
Yes.
So you expect everyone could be that way. That's not the case, and you do have to have the patience.
No, just take it day by day and figure out what way you want to move forward, and always be there for everybody who needs you.
Say goodbye to the lovely people.
Goodbye,